Let's turn now to Dr. Isaac Bogash. He's an infectious diseases specialist. Joining me now from Toronto. Always great to see you. Thank you for your time, Doctor.
Good morning, Jennifer.
I want to pick up on what Laura was just saying about the protection from 2 doses reported now to have fallen to less than 15%. What's your reaction to that?
Yeah, I mean, it's pretty clear that Omicron chips away at some of the protective immunity that we get through vaccination or through recovery from prior infection. What's really impressive, though, is that 2 doses still does a lot of heavy lifting in keeping people out of hospital, out of the ICU, and preventing people from dying. This, as many people have been saying before, the 3rd dose is really helpful, and we should be thinking of this as a 3-dose vaccine series because that 3rd dose will offer additional protection against people actually getting the infection in the first place. It's not perfect. Of course, it's not perfect. You will see some breakthrough infections, but it's very likely that that 3rd dose not only will provide more protection against getting the infection, but having more symptomatic or more severe infection versus having 2 doses or 0 doses. But again, as Dr. Uni mentioned earlier, this data is early and we need to see more robust data. But that's sort of the trend that's emerging from all over the world.
Dr. Uni also said we could see a rise in hospitalizations as soon as in the next few days, given this waning immunity. In fact, Toronto's University Health Network has announced that it is reopening its COVID-19 unit on Sunday because of a rise in admissions. What do you make of all of that and the impact on hospitals?
Like right after this interview, that's exactly where I'm going to work. I mean, this is a sad reality of when you start to see very, very high case numbers. And while we have several things working in our favor, a high rate of vaccination with 1st, 2nd, and 3rd doses, a variant that just appears to be causing less severe illness compared to the Delta variant. I mean, those are obviously working in our favor and helpful. But on the other hand, when you still have an enormous number of new infections per day and an enormous community burden of COVID-19, some people are going to land in hospital, and that small percentage of a massive number of people infected still ends up being what might be a lot of people that require medical attention. The other thing that's compounding this, and I'm not sure people are truly aware of the issue, is personnel issues, right? Even before Omicron came around, over the last year, hospitals and healthcare have been stretched thin. There's very little in the way of wiggle room because of attrition from healthcare. We just don't have the same number of people working. And that's very challenging. And then when you factor in Omicron, we have a lot of people that are out of the workplace now because of an exposure to the virus or because they're infected, and that's compounding problems as well. So even though on paper it might look like, hospital X has this number of beds and hospital capacity is this big, you actually have to have staff to work it. You have to have staff to be there to keep those beds running. And so this is, I think, going to be a significant challenge as we move forward through this Omicron wave, is truly staffing the beds in the hospital. We're starting to see that in other sectors. You've heard about airlines canceling flights because they just don't have enough people to work. So this is going to be an issue throughout this wave that extends well beyond the hospital sector.
Well, on that front, the front of staff shortages and, as you say, workers in other industries too, I want your take on the CDC now recommending the self-isolation for asymptomatic cases be reduced from 10 down to 5 days, matching up with evidence that people are most infectious in the 2 days before and 3 days after their symptoms. So to your point of staff shortages and bracing in hospitals for potential rise in numbers, is this something Canada should look at?
Yeah, it certainly is. I mean, I think it's very reasonable to suggest that we could shorten the period of isolation. Now, what they've done is they basically said, listen, instead of isolating for 10 days, you can isolate for 5 days. And as long as your fever has gone away and your symptoms are improving, you need to wear a mask for the next 5 days. That's probably going to be really helpful. On the other hand, it's, just to be totally transparent, you're probably going to have some people that are going to come out of isolation a little bit too soon. You can add some further protection to that by either extending the isolation to, let's just say, 6 or 7 days. That'll probably get more people to be less transmissible when they come out. Or you can have, for example, a negative test or before you come out of isolation. That might add a little bit more strength to that so that you don't have people that are transmissible coming out of isolation. Having said that, though, I mean, they'll be right. The vast majority of people, but not all, but the vast majority of people after their 5 days when they come out and they're wearing a mask in public will probably not be contagious to others.
All right, good to know. I want to ask you about rapid tests. People feel they've hit the jackpot if they can even get their hands on one. But of course, there are questions with them as well. They've become a go-to measure, as you know, when people can't get into the COVID testing centers. And many experts are now discussing the best way to actually do a rapid test. Some saying a throat swab, in addition to a nasal swab, is more likely to catch the virus in your body because of where it first takes hold. What do you make of that?
Yeah, I mean, these are some very interesting observations. I have yet to see robust data demonstrate that, but you don't necessarily have to wait for that. I mean, when you have so many observations, I think it's quite reasonable to do the throat swab first, obviously, followed by the nasal swab to increase the sensitivity of that test. I think we're seeing a lot of arrows point in that direction. And, we might ultimately see this studied and this come to, we might see the data that supports that. But I think that's a pretty reasonable approach, at least for now. And we also have to remember, too, these are not perfect. These are helpful tools to answer the question, am I contagious to others right now, yes or no? And remember, that test is only as good as what the time it's taken. You can't do a test and even if it's negative, think the next day that test is still valid. So it's only as good for the time it's taken. But yeah, I think we'll probably end up seeing greater sensitivity of that test with a throat followed by a nasal swab. But let's see what the data shows. I know many people are doing that now to increase the sensitivity.
So much changes every day, and that is why we love having you on to help explain it all. Dr. Bogoch, thank you.
My pleasure. Have a great day, Jennifer.
You too.